community-based grassroots organizations fighting for single-payer health care. That is Medicare for everybody, including the undocumented. And so we organized in 2007. There's a statewide group called New Yorkers for Single Payer. And there are regional groups all over the United States. There are doctors groups, labor groups. There's Healthcare Now, which is a national organization. We have a real movement here.
Good luck with you.
Hi.
I believe healthcare is a human right, and I don't see any other way of accomplishing universal coverage where everybody is in and nobody is out, unless we have a single payer system. It's nothing but a bailout for the insurance companies, because by mandating people to buy insurance from private insurance companies, and you're really giving a big premium to the insurance companies, and taxpayers' money is going to go to the insurance companies. Wow, it would be so much simpler if the government would just decide. Yes. Medicare, it's already there, it's in place, it's functioning. Expand it, improve it, cover everybody.
My opinion is there is a monopoly of private companies trying to take advantage of poor people in the capitalist kind of system. And we need to do away with the old system and try something new for the change.
Yes.
Why?
Because everyone deserves to have health care. It is a right.
You mean like a human right?
A human right. Just by virtue of being born, you deserve good health care.
You're from New York City?
Yes, Brooklyn.
Healthcare is a right! Fight, fight, fight! Healthcare is a right! Fight, fight, fight! Healthcare is a right! Fight, fight, fight!
There is no reform as long as there's not a public option that allows everybody an opportunity to get in. And it is unfortunate that while Labor plays lip service, it does not actually mobilize the rank and file to make the government do what it ought to do. Organized labor has become one of the departments within the Democratic Party. And unless the Democratic Party sanctions the behavior, they don't do anything at all. And that's unfortunate, because what it would do for workers, if we could lower future increase in costs and allow that money to go towards wages or pensions, we're losing that opportunity, and labor is losing the golden opportunity.
It would save hundreds of billions of dollars, and that's enough to pay for the health care that everyone needs. So we really need to get everyone into Medicare. It's the part of our healthcare system that works the best today. Obama says all the time we need to build on what works. Private health insurance doesn't work. Private insurers are the cause of our healthcare crisis. They're not the solution. The solution is to put everyone in Medicare. If it's good enough for grandma, it's good enough for everyone. It's pretty clear that money in politics is the reason why we have a dysfunctional government that has hundreds of billions of dollars to bail out banks that failed, but doesn't have money to give the citizens the right of health care, which every other major industrialized nation has.
As far as what is coming out of Congress, it's become so wimpy and so worthless that it's almost not worth talking about. Women are impacted, well, that they would dare to actually try to diminish women's access to reproductive rights through some kind of maneuvering in this healthcare reform process is breathtaking. I would just like to talk about all of us being impacted by the healthcare crisis in this country. It is unacceptable that there are tens of millions of people uninsured and millions more, tens of millions underinsured. You may think that you have good health care coverage with your employer-based health plan. You will not know until you are hit with crisis. The majority of people whose bankruptcies are triggered by health care costs were employed, did have insurance at the time.
I think with what the government is spending right now with the government programs, they can cover everyone if it just everybody went to Medicare and Medicare took over. As a disabled person, I mean, I see what happens to me, to other disabled people. if they think they have good insurance, good private insurance, when they become disabled, they find out how bad the insurance is, how little it covers. Then they get dumped and they join the uninsured and the uninsurable because nobody will insure you. Even if you want to stay active, continue to work and be productive, you can't, because if you get a job, the insurance is not going to cover you. They're not going to want you. So what happens is that you kind of are forced to go on disability. Even if you would like to work, you go on disability just so you can get Medicare. You have to wait 2 years, then you get Medicare.
In the meantime, you might lose your house.
In the meantime, you might lose, you might lose your house, you might lose your life, you might lose, if you have no insurance and you're disabled, you're very likely, to die, and maybe that's what they want.
We've been doing actions for 2.5 years in New York City, working hard every day to get the message out about a national single-payer Medicare for all system in this country. But we've been defeated everywhere we turn. Only the progressive media is covering this story. It is scandalous